Hi, this is Dr. Vinod Revankar. I am bringing you a very interesting case, what we call as typically a fibroid or leiomyoma, a tumor within the uterus. Yeah, conventionally the treatment modality depended upon either surgical intervention in terms of removing the tumor, what we call as myomectomy, or removing the uterus. Yeah, the indications being somebody is facing with monthly issues of a heavy bleeding, menstrual bleeding, passing clots, regularly ending up in an anemia, maybe or may not be requiring transfusion, or every menstrual periods or cycles being associated with severe unbearable pain in the pelvis and in a respect of thigh, what we call as dysmenorrhea, or the bulk of the tumor itself causing heaviness, dragging sensation, discomfort, uneasiness. And there are multiple other reasons when we really intervene. We look at a treatment of getting this fibroid or the leiomyoma tumor getting rid of. It's a benign tumor, doesn't have, because if they are in multiple numbers and if it is in a larger size, definitely it can impact into the quality of health of an individual who is having this tumor. So conventionally the treatment modality what was being practiced all these years is either removing the tumor if it is single or multiple also at times, or it sometimes would end up in getting the whole uterus being removed if somebody has completed the family and multiple tumors with a lot of trouble. We have recent advances which have been developed into the treatment wherein you don't have to subject yourself to the scalpel or the blade of cutting down your abdomen or vaginal hysterectomy or whatever the modality of treatment. You don't have to. It's a simple procedure when we talk of minimal invasive surgery or procedure what is called as an uterine artery embolization. The tumor, the fibroid, what is called leiomyoma, the medical term, thrives on a rich blood supply. So what uterine artery embolization we opt or look at it is, we try to block the supply of blood supply to the tumor and induce a natural death of the cell. It is a procedure which may take from half an hour to 45 minutes or max 1 year, with probably 1 day of an ICU stay and maybe 1 or 2 days in the ward, and you get discharged. There's absolutely no cutting down, no subjection to surgical blade or surgery, wherein your recovery time can take place 1 week to 2 weeks. It's a simple daycare procedure with a 1 day stay in the ICU or 1 day stay in the ward, and you get discharged. This was an interesting case where the tumor measured a size to the tune of 15 centimeters. On clinical examination, the tumor was almost extending above the umbilicus, almost reaching the Ziphy sternum or just below the epigastric region. And there were a lot of discussion, debate on whether to go to surgical intervention or like removing the entire uterus or going for uterine artery embolization. And somehow the decision was left to the couple and the family who was supposed to undergo the procedure, the lady who was supposed to undergo the surgery. We explained the pros and cons and they opted for uterine artery embolization. So I'm showing you here the uterine artery with multiple branches supplying the tumor, and the whole tumor thrives on the rich blood supply. So we do block this tumor by inducing or introducing certain particles which slows down the flow and blocks the flow. Once the flow to the tumor is blocked, it goes through a natural process of natural death over a period of 2 to 3 months. The tumor almost regresses 70 to 80% from its original size, and maybe an individual may face 1 or 2 days of pain, but over a period of time a person is back to work or routine life within 4 days to 5 days time, or max within 1 week's time. It's not really taken up in a major scale probably in India because of lack of awareness, and probably not much referred to the cardiologist. It's always a field of competition between the gynecologist and the interventional radiologist or the cardiologist who do this procedure. But by and large, it's very simple procedure, a procedure of half an hour to 45 minutes without cutting down, with 1 day stay, and you get discharged and you get an excellent result. And this is one of the interesting case wherein tumor was 15 centimeters. In a period of around 20-25 days, the tumor regressed almost 5 centimeters less. The recent evaluation, ultrasonographic evaluation revealed that tumor had regressed to 9 centimeters. So that was a phenomenal benefit to the patient, and the comfort expressed by the patient was very good, and she was very happy. In fact, she felt her uterus being saved, ovaries being saved, and she would have the regular menstrual cycles. Thanks, and we will be coming up with further new interesting cases in the field of interventional cardiology, what we practice at VR Revankar Hospital. This is one of them, odd case which has been done with an excellent result. For any further information, you can, for anyone interested for this, you can reach out to VR Revankar Hospital. We display our number. Show me that image. Okay.